President at Bronx Municipal at Einstein, and he doesn't remember this, but he and I did the last straight endoscopy before flexible endoscopy at Einstein, at Jacobi actually. Chaim has gone on to bigger and better things. He has written many papers. He's got done the nephrology residency. His biography is in our program. He is the chief of nephrology at New York Hospital Queens. He is a clinical professor of medicine at the Weill Cornell Medical College, which is a very difficult thing to achieve. And he is a superb nephrologist and hypertension person. Those of you who are not aware of this, if you have high blood pressure, it's best taken care of not by a cardiologist, actually not best by a general internist, but by a nephrologist. And with no further ado, Dr. Charytan.
Thank you. It's particularly nice to get that type of introduction from a former teacher, so it's nice to be here. Okay. Excuse me. As you'll notice, the talk is labeled as a presentation for a lay audience, so that if this is too simple for some of you, or if it by necessity glosses over a few things that you have issues with, feel free to challenge me or ask me some questions at the end, and we'll be glad to deal with them. We'll be talking about hypertension a little bit, and then about kidney disease, and I think, as I mentioned on one of the slides, the reason they go together is because one of the main target organs for damage from hypertension, high blood pressure, is the kidney, and conversely, the kidney is one of the main causes of hypertension, which is why, as Mel mentioned, nephrologists have become experts in dealing with hypertension as well as with kidney disease. The blood pressure is, just to define it for you, is the pressure that's needed to circulate blood throughout the body so that nutrients and oxygen can be delivered to the tissue, and also so the blood can remove waste products from the tissues for elimination from the body. So that's the purpose of the blood pressure. There are three components to determine the blood pressure: the pump that makes the blood go around, the volume or the amount of blood that's present in the blood vessels, and the blood vessels themselves, how compliant, how distensible they are. And I'll explain that a little bit better. As you can see, it's a little bit analogous to trying to blow up a balloon or sip soda through a straw, as illustrated in this cartoon. Essentially, how much force do you need to blow up the balloon? That's the pressure, that's the equivalent of the pressure that's generated in the body. Or when you sip from a straw, how much pressure do you have to apply? As you well know, if it's a liquid, you'll apply a certain amount of pressure. If the fluid is more viscous, like melting ice cream, for example, or something like that, you'll have to pull harder. So that's what the pressure is all about. And there are three components to it again. How much force are you blowing with or sucking with? How distensible is the balloon? If the balloon is made of a very tough substance, it'll be very difficult to blow up. If it's very pliable, it'll be more easy to blow up. And that's analogous to the blood vessels in the body. And of course, how much fluid or air are you trying to push into the balloon or suck up through the straw? The more you want, the more volume you want to move, the more pressure will be required. Now, the components in the body that do all this are the heart, which is the pumping organ that pumps the blood through the body. The volume is the amount of blood that's being circulated per minute and that's present in the blood vessels. And the resistance is how distensible are the blood vessels. The blood vessels can be, in arteriosclerosis, are very stiff and they can't be distended, or under the influence of certain hormones, they clamp down and they'll increase the blood pressure. In other situations, the blood vessels can become very pliant and the blood pressure can drop. There are two components to the blood pressure that you may hear about occasionally, and they represent the numbers that I'm sure all of you are acquainted with. There are two numbers to the blood pressure. The upper number is called the systolic blood pressure, and it represents the pressure that's generated when the heart first pumps or contracts and pushes a volume of blood out of the heart into the blood vessels. That's the upper number, called the systolic number, and you can have systolic blood pressure. The blood pressure is high during that period. The diastolic blood pressure is the period of time after the heart has stopped pumping, when the blood that has been pushed into the blood vessels now slowly, somewhat slowly, distributes throughout the body into the smaller and smaller blood vessels and gets to the tissues. That's called the diastolic, and that in particular also depends on how easily the blood vessels dilate and permit the volume of blood to move around and get to the tissues. Now, if the heart pumps too strongly, that can cause high blood pressure, and that happens in certain circumstances. You probably all heard of the thyroid gland, which is a gland in the neck. If that's overactive, that can cause the heart to pump excessively strongly. There's certain abnormalities of the heart valves that can cause systolic blood pressure. There's an endocrine or hormonal abnormality called pheochromocytoma that can cause the heart to pump very strongly, and so on. So there are a number of issues that can do this, and there's some normal. In athletes, it's common to have a very high systolic pressure, but not a moderately high systolic pressure, but the diastolic tends to be normal, and that's because through their athletic activity, they built up a very strong heart muscle. Now, so that's the pumping component of the blood pressure. There's the volume component, which I mentioned to you, how much blood has to be pumped around the body. And there are a number of conditions, which I won't go into in detail, but there are a number of conditions, hormonal conditions, excessive salt intake, kidney disease, which does not permit salt and water to be eliminated from the body, that will cause the blood volume to expand, and in that case, we have a volume-related hypertension. Some people, some physiologists and blood pressure experts think that most blood pressure is actually, in fact, a mild, not easily detectable, but perhaps measurable increase in the amount of salt and therefore volume in the body. So salt, by all accounts, is a very important component of hypertension. I know, but it's hard to see what I'm referring to. And the third component is what we call vasoconstriction, or again, that's the distensibility of the blood vessels. The blood vessels, as I mentioned to you, under some circumstances can become very stiff because of what we call hardening of the arteries, or athero or arteriosclerosis, or they may clamp down under the influence of certain hormones, so the blood vessels become narrower and do not distend when the heart pumps blood, and that will lead to hypertension and its consequences, which we'll discuss in a moment. Essential hypertension, essential, by the way, is just a way of saying we don't know why, but it's the most common form of hypertension that exists. It's an extremely common problem. It's the most common form of high blood pressure that we deal with, and it's present, as you can see, in some 70 million people in the United States or more. So it's a serious problem and a very common problem that we have to deal with in clinical medicine. Essential hypertension is the commonest form of high blood pressure. We don't really know for certain the mechanisms that cause it. As I mentioned a moment ago, some people feel that it probably is for an accumulation of excessive salt in the body, salt and water in the body, by some hormonal or other mechanisms, and that causes an increase in volume, and that the blood vessels react to that in order to protect the tissues from being flooded, if you will, or what we call overperfused. The blood vessels clamp down and cause high blood pressure. There is, in fact, a certain segment of the population in whom this can be demonstrated on a clinical basis. That is, the blood pressure is extremely sensitive to salt intake. In all of us, salt will probably influence the blood pressure, but there's a segment of the population and certain experimental animals in which this is very obvious. So clearly, salt plays a very important role, which is why Dr. Bright removed the potato chips from the entry to the synagogue. There are many mechanisms for high blood pressure, but the important point is that regardless of the mechanism of the cause of the high blood pressure, it can cause both acute and progressive damage, and that's very important. It can cause, if the blood pressure rises rapidly, severely, or acutely, it may, such as what's called malignant hypertension or accelerated hypertension, it can cause damage very quickly in a matter of months, or even more quickly than that in a matter of weeks. If most of the time, in most people, the blood pressure rises to modest levels, but it still causes damage, except in that situation, it causes it on a slow, progressive, cumulative damage. And that's something that people often have difficulty understanding because they feel well, but what they miss is that this is a progressive disease with slow increments of damage, which ultimately can add up and cause a number of problems. The reason blood pressure causes damage is because, first of all, hypertension stimulates what we call inflammatory processes, inflammatory reactions in the body, which can cause tissue damage. If the blood pressure rises, the small blood vessels in various organs of the body have to sort of constrict down, further aggravating the blood pressure. They do that to protect flooding of the tissues with excessive circulation, and therefore the tissues become ischemic, meaning they get starved of oxygen and blood, and that can cause problems. The organs, and eventually scarring, which is what fibrosis means, and damage. The three organs in the body which are most susceptible to hypertensive damage are the kidney, the heart, and the brain. In the brain, this manifests as strokes or bleeding into the brain. In the kidney, it will manifest as progressive kidney failure, and in the heart, it will manifest predominantly as eventual congestive heart failure, fluid accumulating in the lungs, shortness of breath, and so on. It will also contribute and aggravate underlying coronary disease with, heart attacks and angina and so on. I mentioned this already. These are the problems that occur with progressive hypertension. It may happen more acutely if the hypertension is very severe. It will happen over a period of years if the hypertension is moderate, but it's a frequent consequence of uncontrolled high blood pressure. Now, hypertension, I labeled this good news, bad news. The good news is that it's a generally treatable condition. It's one of the more easily, in a sense, treatable conditions. It's one of the conditions, for example, in kidney damage, where we can prevent damage or prevent progression of the kidney disease or progressive heart damage or the like. The bad news is that hypertension is silent and it's often unappreciated, both in terms of its present, and is therefore often untreated because both patients and physicians don't appreciate that it's a serious problem. There's frequent misconceptions about hypertension. One, I can tell when my blood pressure is elevated. That's very common. It's not true. Patients come in, they tell me, well, I can tell when I have it because I feel flushed or I have a headache. And if one, for example, were to put what we call an ambulatory blood pressure monitoring device on the arm and patients wear it for 24 hours, and they keep diaries, there's no correlation between when they think the blood pressure is up and not. So that's often a mistaken concept. Another mistaken concept is, why should I take medication when I feel fine? The answer to that is because hypertension is silent, and it's a silent killer, and it's very important to take medicine even if you feel well at this time, because the damage is cumulative. Another one is, I'll take my pills when the pressure is high. There are medications that we use in medicine, such as antibiotics, which cure a condition. There are other medications, however, which control a condition. Hypertensive medications or antihypertensive medications control the blood pressure. They don't cure it. There are a few infrequent situations where the cause of the blood pressure can be removed, usually surgically or by some other means, by balloons and so on, like we do in the heart, but that's uncommon and very infrequent. Most blood pressure can be controlled but cannot be cured, and therefore people need to take, who have high blood pressure, need to take the medicine on a regular basis, because otherwise they have spikes of blood pressure between medications that can be quite damaging. I don't want to get habituated to the pills. Well, antihypertensive medicines are not habituated. You need to take them regularly, not because your body gets addicted to the medicine, but because the blood pressure is persistent and needs to be controlled. And finally, and reasonably, people worry about the side effect of the medication. And here too, there is good news. Although antihypertensive medications do have side effects, they're generally recognizable within a short period of time of starting the medication, and they're generally reversible when the medicine is stopped, generally not serious, and there's no evidence that any of the antihypertensive medications have a cumulative effect. So taking a medicine for a long, an antihypertensive medicine for a long time does not cause progressive damage. There's no reason to worry about long-term side effects of these medications. As I mentioned, occasionally we have surgical or radiologic techniques where we can cure the hypertension, but most of the time it's medical treatment with medications. Medical therapy has multiple components. By far the safest component or approach to the treatment of hypertension, but one which is very difficult to implement, is weight reduction that can have a major effect on blood pressure, limiting salt intake, smoking cessation, and exercise. However, as you all will recognize, this is something that most patients find very difficult to adhere to, but it's by far, it's an effective and safe method. Depending on the severity of the hypertension, it may not be enough by itself, but it certainly might reduce the amount of medicine that an individual may need, and in some situation may be all that needs to be done. And then there are a whole number of drugs. There's certain important principles. I'll just mention a couple. This is a mistake that physicians make, and occasionally patients push in this direction. When hypertension is diagnosed, a medicine is started and does not necessarily work or have an effect or the total desired effect, and then someone wants a different medicine. In general, as a rule, if one medication won't work, then the chances are that another one by itself won't work either. And most of the time, when one deals with significant hypertension, one has to follow a stepwise or an additive regimen. You start with one medicine, you push it to the appropriate amount, depending on the patient and so on, and then you need to add another medication, and occasionally a third and a fourth if the blood pressure is severe enough. switching from one medicine to another is generally wasteful and harmful, with exceptions, obviously. Water pills, what you would call water pills, what they really remove from the body is salt primarily, are often the first choice and among the safest approaches. But there are a number of other medications. A particularly useful class of drugs among the somewhat newer medicines are what we call ACE inhibitors or angiotensin receptor blockers. And I'm just singling those out because while antihypertensive medicines do not have long-term cumulative effect, they do have side effects on a short-term basis that people may find uncomfortable. The ACE and ARBs, as they're called, tend to be among the more effective. Generally, with exceptions, tend to have fewer side effects than the other medications. They may have specific protection for the kidney and the heart, and they do not have one side effect, which is often a limiting factor, particularly in male patients. Many antihypertensive medication have a negative effect on erectile function and libido, and therefore patients won't adhere to the medicine. This group of medication doesn't have that side effect. But we're fortunate in that there are a fair number of medications. These are classes of drugs. These are not individual drugs. And there are more of them that can be very effective, and most patients can have their blood pressure controlled. Okay, that's sort of in a very quick way an overview